You're tuned in to the Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started. Hey, real quick, guys, before we start the episode, I want to share something that I'm really excited about. I know how hard it can be when your hormones feel out of balance, low energy, mood swings, and not feeling like yourself, which is why I created the supplement line Optimal Harmony. With natural science-backed ingredients, it's designed to support your hormones, stabilize your mood, and help you reclaim your energy and confidence, because when your hormones are balanced, everything feels easier. You deserve to feel amazing every day, so let Optimal Harmony line of supplements help you get there. Hey everyone, welcome back to another episode of the Dr. Kinney Show. This week I'm really pleased to have joining me my friend, colleague, and associate here at the Kinney Clinic, Dr. Ana Rodriguez. She and I actually went to high school at the same high school. We've known each other for a really, really long time, and it's a really cool full circle that she is here working with us. And we today are going to have a great conversation about postpartum support, birth to postpartum, which you'll learn in today's episode that postpartum is not just the 6 weeks after you have a baby. It lasts a little bit longer. Yes. So thank you so much for agreeing to be back on the show again. It's great to have you.
Thanks for having me.
Yeah.
Yes.
Do you want to start by just sharing a little bit of your background of naturopathic medicine?
Yeah, for sure. So I am a naturopathic doctor, and then I also have my master's in Chinese medicine and acupuncture. So I'm always wearing both of those hats and looking at things from like a Western medicine perspective and then a Chinese medicine perspective. So I went to Bastyr University out in Seattle, which is a 4-year program, but since I did 2 programs, I was there for 5.5 years. And then after that, I did a residency out in Chicago, where I saw 3,200 patients in 2 years, which is a lot. Yeah, a lot of patients. Yeah, a lot of reps, a lot of repetition. And it was mainly like primary care focused, but with, women, lots of women's health, lots of gut health, kind of everything under the sun. I saw a lot of different things.
Yeah.
Then we moved back to Maryland and reconnected with Dr. Kinney
here. She's been here taking care of so many of our patients. It's been fantastic. Everyone loves her. It's great.
Yeah, it's been awesome.
Yeah. And you just had a baby, number 2.
A baby.
So she's kind of dealing with the postpartum stuff herself for the second time around.
Yes, real time.
Yeah.
Real time.
Yeah. So you want to share your birth story?
Yeah, I would love to. Yeah, it was awesome. So I actually had a home birth with my first and second. I had such a positive experience with my first, even though it was a really, really long labor. It was 40 hours with Maxwell.
That's crazy. I can't do that.
Yeah, it was wild. But it was great. I had so much amazing support. My mom was there. We had like 4 midwives, my doula. It was just like, it kind of felt like a party, even though, I was really exhausted. Yeah. But yeah, so I had such a great experience that I was like, I want to try to do this again. And so I found an awesome practice in Baltimore. And they were actually associated or had worked with St. Joe's Hospital. So that was my transfer plan. But yeah, it was the second time around was much faster. I think everybody was kind of like, oh, maybe it'll be, 16 to 20 hours because your first was so long. But yeah, so when I went into labor, it was Friday night. I was watching Parks and Rec, just kind of relaxing. And then I was like, I feel a little crampy, but we'll see what happens. My husband was putting our toddler to bed. And then, the contractions kind of picked up a little bit, started coming more frequently. So yeah, I called our doula and she was like, let's just kind of see, maybe take a bath and see what happens. Maybe things will slow down. And so yeah, but things kind of kept picking up and we started the bath, and before I could even get inside of the bath, my water broke. So then it was like all hands on deck. The doula called the midwives and everybody kind of came over. But it was really awesome because it was so peaceful. So we were upstairs in our bedroom. The lights were off. The midwives were kind of just hanging out, relaxing in the corner, just waiting for things to happen. I think a misconception that people have about home birth or outside of hospital birth is that you don't really have any medical support. So I worked with certified nurse midwives. So they have hospital training, but they bring all of their entire resuscitation kit. They bring IVs, Pitocin, like anything that you might need.
Yeah.
And they are also monitoring your vitals every 30 minutes.
Yeah.
So
it's, I mean, you're getting the similar support, and most home births, I know I had two as well. Like, you will have a backup plan, as you mentioned. Like,
exactly.
If XYZ happens, we'll go here.
Right. And they don't mess around. Like they're really, they're on top of it. Like they're watching you. And again, like you have the same team the whole time.
Yeah.
So they're very attentive, but also give you your space, which is really nice.
Yeah.
They were kind of just relaxing until it sounded like I was in transition, which,
It's the really sucky part.
And this time around, my contractions were very different from my first. I don't know if you experienced that.
Just more intense. I
more
just remember them
intense.
being, my second came a lot faster too. I feel like I was in labor with my first daughter for maybe 22 hours, and the second one was only like 8 hours.
Yeah.
So much faster.
Yes. Yeah. So, my second was 6 hours total from start to finish, which was wild. And I ended up having a cervical lip, which is essentially when your cervix is a little swollen. And then as the baby's trying to descend, the baby's head is kind of just like pinching your cervix, which makes the contractions really painful. So they ended up just pushing my cervix over his head, which is really painful at the time, but it helps a lot when it's finished. Yeah. And again, that's just like another tool that midwives, they're
trained to do that.
Yeah.
Right?
Yeah. They're just so creative with and they understand your anatomy so well and how to kind of position you and work with your body to get the baby out. After that, in my mind, I was like, oh, this is going to be another like 20 hours. I can't do this.
Yeah. But 6 hours, that's like easy peasy after 40.
Right. Yeah. And like, it was really, really intense, I would say, for like an hour and a half. And I was like, I don't know how I'm going to keep doing this. Yeah. But after she moved, kind of adjusted my cervix, felt
so much better.
I felt so much better. And literally 15 minutes later, he was out. She was like, you're going to meet your baby really soon. And probably within like 3 pushes, he was out. It was it was just so different. And he was actually born in the tub. So I really wanted a water birth with Maxwell, my first. But it didn't happen because the water was slowing down my labor. Because the water like really helps with pain.
That's so funny. My first daughter, I labored for a long time in the tub. Yeah. And I remember calling when I was in labor, and they were like, have a glass of wine, take a Benadryl, and get in the bath. And I was like, this is fantastic. Yeah. And then it was like 9 a.m. and I was like drinking wine and taking a Benadryl. Yeah. I think the bath slowed my labor down too.
Yeah, it's wild. I mean, because it relaxes everything.
And you want, when you're contracting, it's not supposed to be relaxing. Right. You're supposed to be contracted to get that work done, to get the cervix open.
Yeah, I feel like it's one of those things where it's super helpful, but if you get in too early, it kind of just slows everything down. Yeah. And I think that happened with my first. But with my second, it really does reduce pain, at least for me. Everybody's so different, but like I would say by 60%. Like that's
awesome.
Wild. Like the difference between contracting out of the tub and in the tub was like, it was night and day. Yeah. It was really cool to kind of have that experience because I really wanted that for my first. So it was great for him to, be born in the water. Yeah. And, it was great. And then, after that, we just went straight to our bed, which is amazing.
That's the best part of a home birth. You don't have to go home from the hospital. You don't have to pack up your stuff and leave. And if you have other children, they can be at home. They don't have to, and they can meet the baby right away, which is really nice.
Yeah, it was really nice. Maxwell was asleep, but he did wake up at some point, like during the birth, and came in and was like, "Oh, what's going on?" and then went back to sleep.
Yeah.
My mom was
I gotta
there.
Get my sleep. Yeah.
Yeah. So that was really nice. And it's also awesome because it's way more relaxed. Like there's no rushing around. There's no. They wait to cut the cord and everything, and really, truly just like wait for the placenta to come. Yeah. So they again, everybody's just hanging out, taking my vitals, making sure I'm drinking water, like making sure everything's good. But it was awesome. I just felt so supported, and again, it just felt like a party, like hanging out with your girlfriends,
Yeah.
like, oh yeah, like meeting the baby. Everybody was guessing the baby's weight. And I was like, oh, I think he's 7 pounds. And they were like, no, like, girl, this baby is not so. He was 9 pounds, 3 ounces. So I was 2 pounds off. But yeah, it was awesome. It was
so
really
fun.
cool.
Well, I think you said something there. You felt so supported. And that's such a good... That's. I feel like that's what a lot of women miss out in, whether they're having a birth in hospital or somewhere else. Like, I think during the birth and during postpartum time, and what's really nice about a home birth, and you can get that experience if you get a doula, and I feel like you can sort of tailor experience if you don't want a home birth, because sometimes that's terrifying for people, and that's totally okay, right?
Yes.
I think just say this message now, like, what you want for your birth is your decision, and maybe that's a home birth, maybe that's not.
Exactly.
I think a doula is the number one, or an army of doulas is like the best thing you can do, because they are there to support you.
Yes.
And I think a lot of times in Western medicine, they take care of the mom, they take care of the mom. Once the baby's born, they're like, all right, mom, push aside. Like, we got to focus on the baby. And like, then the mom is like, wait, I just went through this like intense experience and my body is falling apart and I don't know what's what. And my hormones are all up, which we'll get to that in a minute. But like, you don't feel supported, right?
Yeah.
And if you have a traumatic birth, which a lot of women do, a doula can be there to take care of you. So I'm a huge fan of doulas. I think they're like...
They're the best. The best.
They're really the best.
And they're amazing. I mean, there's birth doulas, there's postpartum doulas. There are even doulas that work in hospice care, so end-of-life doulas, which is amazing.
Yeah.
They're so supportive. And I think especially in a hospital setting, like you said, like, go with what feels good for you, whether it's hospital. Some people, even plan C-sections because the idea of birth is traumatic. Maybe they've had sexual trauma in the past or a traumatic birth. So whatever you choose, I think, like you said, the biggest thing is having that support and having, like, feeling like you have autonomy and you are the one making the decisions. And sometimes, obviously, emergencies happen and things do need to move quickly, but I think having a doula there, you have somebody to advocate for you and kind of be like, okay, this is what's happening. This is why it's happening. Like, what would you like this experience to look like? Yeah. And it's so beneficial. And they also come visit you after you have the baby, which is really nice.
Which I think is a nice thing too. They know you so well, right? Like, and this is what's the benefit of a home birth midwife, is you usually do your prenatal visits at home. Yes. She comes to your home, she knows you, she knows your family, she knows your what. So like, when you are in labor, she already knows your body, she knows your personality, she knows what you want. You've talked about it so much. And not that you can't get that from an OB, but sometimes in a big OB practice, you might not see the same person every time, right? So you might not actually know who's going to be there when you're delivering. And some people are fine with that, but if you really want that true, like, personalized support, I think it can be a really cool thing.
Yeah, and you can do midwifery care in the hospital too. Yes. Like, some hospitals do have, midwives, which is awesome.
Really great. GW, if you're local to, we're in Maryland, GW Hospital is fantastic. They've got a great midwifery group, and I think look up, like, and if you want kind of a blend of both, a midwife and a hospital, it's a fantastic combination.
For sure. Yeah.
I remember I had this amazing doula that was at my first birth, and she was planning to come to my second birth, but my birth happened during this like giant snowstorm in 2016. There was like 4 feet of snow, and she lived a couple hours away and could not make it.
Oh no.
We were and same thing. I went into labor and the baby, she came so fast. It was a full moon, a snowstorm. There were all these low pressure things. If you're interested, you can watch it on YouTube, actually, because our next door neighbor worked for ABC2 News.
Oh my goodness.
And filmed, like, you see the baby coming out. It's called, if you Google Annapolis snowstorm baby blizzard or something, I'll come up.
That's amazing.
It's kind of cool, actually. Yeah. And my favorite part of the video is with my older daughter, who's 2.5, and she comes to meet the baby right after she's born, and she's like, "Happy birthday, Hannah." Oh, it's the cutest thing.
Oh my gosh,
so cute.
That's so cute.
But I remember feeling so sad that she couldn't be there. I mean, luckily I had an amazing midwife that helped out. But she actually came. She came right when she could. She came for the postpartum time.
Oh my goodness.
But that's support, so I feel like, is the thing that kind of so many women need throughout the postpartum time. Yeah, and that's going to change in varying, like, how far you get from the birth, but so many women don't get as much support as they need, right?
Yeah, and even during pregnancy, it's having a supportive care team, and that's kind of why I think I switched to the practice that I switched to when I was in Chicago, because I just wasn't getting the support that I felt like I needed during pregnancy, and so I think having that support, knowing what's coming down the line, I think a lot of times, like for me at least, I was so busy researching like the birth, and I was like, okay, what do I need to know about the birth? And then afterwards I was like, oh,
I
wait,
didn't think about it afterwards.
I was like, oh my gosh, I have to I have to take care of this human. I have to deal with the like hormonal changes and breastfeeding if that's what you decide to do, like all of these things. And I was just not prepared for that. Even with working with like a very holistic practice.
Well,
like,
and it's nice, I think, for people to hear you say that you're a doctor, right? Like, I think, and I remember too, like, I remember taking the birth class and like learning about some of the things that were going to happen that first month, being like, wow, they never really taught us that in school. I'm going to have to deal with that. Like, there's a lot of stuff that I think a lot of women, you kind of forget it, you kind of block it out, but there's a lot of changes that happen in your body. And here's the thing I want to say, like, your body is technically in the postpartum time for 4 years post-baby. Right? Like it takes 4 years for your body to get back to the way, and it will never be the way it was completely before baby, but nutritionally, hormonally, all of the things. And so I get women that come in and they're like, oh, my baby's 3, I can't be postpartum. I'm like, well, I know you're not in the acute postpartum phase, but your hormones are still not, you know, they're not regulated like they were before.
Right.
I mean, they're mostly regulated, but it takes a lot longer, especially if you nurse too. You're you're growing a baby, you're building a human. It takes a lot of energy.
Yeah, so much energy.
Yeah. And your thyroid hormone, your estrogen, progesterone, all of the feedback loops in your body, your stress hormones, it takes a minute for them to get, longer than a minute, like a very long time for them to get back into normal. So if you're listening, you're like, wow, I had my baby like 3.5 years ago and I don't still feel right. You're not alone, and that's pretty normal.
Yeah.
But the good news is there are a lot of things we can do to help you with that, right? There's a lot of tools and a lot of things that can help like get your body back into balance a little bit sooner.
Yes, for sure. And I think that is so important for people to know, because again, you have that 6-week visit postpartum and then you're kind of just like sent out into the world and you're like, but wait, I don't feel right.
I'm not ready to have sex.
I'm like, wait, movement, exercise. Like,
know.
I feel like everything's just gonna like fall out of me. You know, like it's wild. Like you don't feel like yourself at all, and you don't get any labs run.
No,
like
nobody checks your labs.
It's wild. And so I think like just knowing that those are things that you can do, and you can work with a provider who you know actually looks into those things in that postpartum period, even like the acute postpartum period, because there are things that can be caught early on. I mean, like even like you were talking about the thyroid hormone, postpartum thyroiditis is actually really common.
It's really common.
I think it's like 5% of postpartum people experience postpartum thyroiditis, which is essentially when usually it will present as hyper, like overactive thyroid, and then it will kind of swing in the opposite direction. And so you have people kind of feeling, you know, super anxious or experiencing insomnia. And a lot of times providers will be like, oh, well, you're postpartum.
It's postpartum anxiety. That's normal. Here's a medication or whatever. But they don't run any labs.
Right. And I mean, you're not sleeping, but they're like, well, obviously, because you have a newborn. Like, why would you be sleeping? But it's like, well, no, like when I should be sleeping, like when my baby's sleeping, I'm not even able to fall asleep. Like this is a problem. And still, like people don't get labs run. And it's just it's like, oh, well, you're postpartum, you just had a baby, so that's how you're supposed to feel.
Which I just feel like, I'm going to say this, I feel like so many women get treated like this at various points. Oh, you're just postpartum. Oh, you're just menopausal. Yes. Oh, you're just in puberty. Yes. It's just, oh, your hormones are crazy. Oh, you have hysteria because you're a female like, from ages ago. Right? Like, it's like, and wait, but there are actually things that could be really wrong.
Right.
And not to say that, obviously, having a newborn is going to make your body function differently. Menopause is going to make your body, but we can still address maybe some underlying issues there that might not be quite right.
Yes, exactly. And that's the thing, like seeing somebody who will actually look at you as a whole person. So, I mean, looking at your pregnancy and postpartum period, but also as a person. Because again, like so many things get missed. I mean, it's like on the super extreme end of things, even cancer diagnoses, because it's like, well, oh no, this is normal. Oh, like you're breastfeeding, so your breasts are going to be different, or you know, and it's just wild how much
gets written off as you just had a baby.
It's so scary.
So when we're working with patients, because we work with a lot of patients, like from fertility to, you know, and then we'll say, hey, like once you've had your baby, like between 6 and 12 weeks postpartum, go run your labs. So if there is a thyroid problem, we can catch it early on. If there is anything else going on, we can catch it. So you don't, because let's be honest, like the postpartum time, there's a lot of stress on your system, right? And like, we're not going to change that even when you're taking care of your baby. But if you have something else wrong in the system, it's going to make it exponentially harder for you to stay somewhat normal.
For sure.
So I think it is really important to get those labs run. And if they're great, awesome. Then you just have peace of mind and you know, like, okay, we kind of ruled all that stuff out. And it's not that hard to do, right? You go and you just run your labs and you see your provider and you check in. And I think it's nice, you know, to get more support, right? So just like, again,
have a check-in with somebody, check in on how you're doing. And with labs are so important. And even in pregnancy, I see quite a few pregnant people, and I will order additional labs for them that are not being run
by their provider. You pretty much get labs twice when it's like your first round of labs, and they check for syphilis and other diseases, and they look at your iron
and like
great.
Your hemoglobin.
And then they look at it again at week 28. It's kind of the same panel, and that's that.
But they're not running ferritin, which is wild, or like vitamin D, or even looking at your thyroid, which is also wild. And the amount of extremely low ferritin that I see in pregnancy is, and to the point where like my patients will go get IV iron, you know, and they feel so much better. And it's like, you need iron going into childbirth.
100%, because you're going to lose so much blood. And then if you are planning to nurse, and just so if you're listening, you don't know what ferritin is, it's a backup store of iron. So you might have enough hemoglobin levels, but you could have normal iron. But if your ferritin's really low, it's like having no money in your savings account.
Exactly.
So one new roof or set of tires is going to run through your bank account, and you're going to have nothing left. So again, having a baby, you lose a lot of blood. Your iron could very quickly drop. And anemia or low iron can present as depression. It can present as fatigue. It can present as hair loss. It can present as, like, I've even seen cases where people like have like psychosis type symptoms
100%.
from their iron being low, right? So like, it's a really important thing to be checked.
It's so important. Iron is also a cofactor for thyroid, for so many things, but like making that conversion into like your active thyroid hormone, you need iron. And so even sometimes like a sluggish thyroid could be because
you don't have enough iron.
You're anemic. And it's just wild. So kind of starting your lab work kind of in that pregnancy period. So finding somebody who will maybe order some additional labs if like you're not getting the full picture, but then continuing that in the postpartum period, like making sure you're seeing somebody regularly, even if it's just like the mental health check-in, because like I said, that really gets thrown by the wayside.
100%.
Like even like, I mean, I remember going to the pediatrician's office, and they gave me like a little survey.
It's a screening like for postpartum depression.
And I was like, wow, this is wild, because this visit is not even about me. It's about the health of my child, but like no one else is really looking into it. Which is so terrifying.
It is a little terrifying. I mean, I had pretty severe postpartum depression after my second. And we were laughing about this earlier before we started recording, that like doctors tend to be the worst patients. And I had not checked in with my provider, and I look back at the time, I'm like, I probably would have been a lot better off if I'd maybe called my naturopathic doctor and done a check-in and run some labs. Like, I didn't do that. I was like, I'm okay.
Yes.
And sometimes during postpartum, you're okay until you're not.
Right. Yeah. And that's where like that support comes back into play. So even with like your family members, your partner, your doula, kind of checking in and being like, hey, check in on me. And please, if you notice something that seems off, or if you're concerned, like, I'm giving you permission to reach out to my provider. And obviously, or like, talk to me about it. But so that we can catch things. Because, like you said, in the postpartum period, you are so, like, your brain
is like focused on baby.
And like the brain fog, the memory issues, it's wild. But you're not really thinking about your own mental health or physical health. So having people to kind of check in on you and be like, hey, like, something is off here. And a provider that you trust, who you do see regularly, who knows you, who can also be like, hey, like, let's,
you seem a little off. Like, let's run some labs. Let's check in.
Let's talk about this. That's just so important.
And so it's great to run labs. You get information. Then you can quickly be like, okay, let's make some interventions. Let's pop you on some extra iron. Let's have you take vitamin D. Let's put you on some B vitamins. Let's assess your thyroid or treat your thyroid or whatever it's going to be.
Yeah.
There's also some amazing, you want to talk about craniosacral and visceral and how that can be helpful pregnancy and postpartum?
Oh my gosh. So I love craniosacral for pregnancy. It's amazing. So craniosacral therapy is a super, super gentle type of manual therapy where we're really working to kind of balance the cerebral spinal fluid. I work with the bones in the skull. I work on a deeper level, even on the brain. So I'm working with your amygdala, which is kind of like controlling anxiety and those kinds of things. And it's so relaxing to the nervous system. So it really puts you into that rest and digest. And a lot of times people will be like, wait, are you doing anything? Because I'm really barely touching my facial. Like it's so light, like very light touch. But it's really cool. Like the results are amazing. Like people will be like, oh, I saw colors the whole time, or I felt like I was floating, or they'll feel the relief. Like they will literally describe the structures that I was working on and be like, oh yeah, no, I felt this like big, like this sense of heat in my face. And it's very cool. But yeah, so it's amazing for insomnia, especially during pregnancy, like with the musculoskeletal pain that you might have. So like low back pain, rib pain, which is so common. And again, like all of those just nagging pregnancy things, like, symptoms, the heartburn, all of that. Super, super helpful for all of those things. And then also, like I tell people, it's an hour for you to kind of just relax.
And relax.
Close your eyes.
And have someone support you, right?
Exactly. Close your eyes, take a nap, feel better when you leave. Craniosacral is lovely. And then visceral manipulation, kind of similar. There is some energetic kind of component to it, but it is a little bit more direct. So I'm working on the organs directly, which sometimes feels a little weird. It's like, weird, but you're so touching my liver. That's strange, but it feels really good after. So essentially what I'm doing is working to make sure that the organs are moving optimally within the abdominal cavity. So our organs move. So wild. You're like, wait, they move? Yeah, they move. About that. What's happening? Yeah, they shift, they move. And each organ has its own kind of movement pattern, which we learn in training. So when we're learning visceral manipulation, that's part of what we learn. How do the organs move and what should you be feeling kind of when you're working with the organs? So I'm really working on, the organs, but also the fascia, so the connective tissue around the organs. So what can happen is, more obviously, like if you've had abdominal surgery, so like scar tissue adhesions, C-section, yes, there's scar tissue and things can kind of just become restricted. The fascia that surrounds our organs you can develop really tiny, like almost like spiderweb-like adhesions between other organs or between organs and muscles or organs and your rib cage. And what can happen is your organs they're moving and there's nothing wrong with them, but they're just not moving optimally, which, kind of impacts blood flow, lymphatic flow, and you can start to see symptoms like even musculoskeletal pain. So I've had people with like severe rib pain, they've gone to the chiropractor, they've done massage, they've kind of done XYZ thing and it's just not getting better. And we find like, okay, your liver is restricted. We release their liver and their rib pain's gone. Crazy. Because their liver is just not moving and our whole, like everything is connected. So another interesting case is I had somebody who literally could not open their mouth. Like their jaw was completely locked, like could not even get like a spoon in their mouth. And we were kind of trying to figure out like, okay, what's going on? Is it TMJ? So I did some visceral. Their gallbladder was really restricted. Released their gallbladder, their jaw opened. It was wild because it's on the same fascial line. So, it's really cool, but especially after pregnancy. So in that postpartum period,
stuff's all moving around, right? Like you just had a 8-pound, 9-pound baby in there, like taking up space.
Yes, they're pushing on it. Your diaphragm is pushed up. Like everything is just wonky, and it's wonky for 9 months. I mean, as soon as you get pregnant, your hormones start changing. Your uterus doubles in size. Like, I mean, pretty quickly. Yeah. So, I mean, you start feeling the effects, and then with, the changes in your hormones, your digestion slows down. I mean, things change. And so, like you're still feeling those impacts in the postpartum period. So visceral, like I think it should be mandatory that like everybody gets a visceral manipulation and pelvic floor PT. Like that is just like everyone should do that.
Yes. And I've done several episodes on pelvic floor PT. If you want some like information on that, go listen to those.
Yes.
That is a fantastic therapy postpartum.
100%.
Everything down there is also a little messed up.
Yes.
Right?
Yes.
It needs to get like, you got to re-strengthen those muscles and heal down there.
Yeah.
But yeah, especially if you've had a C-section.
Yes.
And there's all that scar tissue pulling on things. And
and the visceral goes really hand in hand with pelvic floor PT. I think if you can do both at the same time, because your pelvic floor works in tandem with your diaphragm. Yeah. And a lot of times in that postpartum period, people's diaphragms are restricted, which like, again, when you're pregnant, it's hard to breathe. Like everything is just so wonky. Yeah. So, helping to release the diaphragm so you actually can take a nice belly breath in and allow your pelvic floor to relax and all of that. So yeah, it's, oh my gosh.
Great. Like just fantastic tools. And I think sometimes when you're in this postpartum time, like it's hard to get to do anything because you're on a newborn schedule. Yeah. But your body does need so much support and you might not even know about it. So if you're listening and you're in the postpartum time, these can be some great tools.
Yes.
Right? Like,
yes. Yeah.
I think the manual body work is so important.
It's so important. And it really does go such a long way. Like even with visceral, I mean, you don't have to come in that often. Like usually after like 3. So I would say after the first treatment, what I tell people is like, okay, you're going to feel really good. And the next day you're going to have the best poop of your life, which always happens. Like I get messages where people are like, oh my gosh, I had the best poop ever. Yeah, that happens. It's amazing.
Because you've created space for the bowels to move properly.
Yeah, I work on the valves. I work on the ileocecal valve, the lower esophageal sphincter, all of that. And all of that just, I mean, it feels so good. And then I tell people, that's awesome. In 3 days, everything's going to kind of come back and just kind of be restricted. Maybe not to the extent that it was before. And that's just really because of muscle memory and like fascial memory. Yeah. And then I have people come back a week later and we work on it. And usually after the 3rd treatment, things usually hold really, really well. Yeah. Because again, we're working on those little adhesions and just restoring optimal movement. And I'm not like, it's not super intense. I'm not forcing anything. I'm really working in the direction of ease, like following whatever the organ wants to do, and allowing like the organs to kind of run the show. Yeah. But yeah, after the 3rd, sometimes 4th, really depending on what we're working on. If we're working with like motility, like a motility disorder, it's probably going to take a little longer. Or even with like surgery, if you've had significant but yeah, usually after 3 to 4.
I mean, I've had some of my patients that you've seen for visceral who've had like heartburn or just digestive stuff, and they'll message me and be like, oh my god, same thing, I had the best poop and I feel fantastic, my heartburn's gone. Like, I think you worked on me. I was having crazy heartburn, I can't remember why, and it was like one treatment and it completely went away.
Yeah, it's wild. I mean, even with like minor hiatal hernias, and that's why like I think being able to look at the body like really holistically, because sometimes it is just a structural thing, and no matter what you do, like no matter what supplements you take, what pharmaceuticals you take, like you were saying, especially with heartburn, like yes, I've had people on PPIs and they try the herbs, they try the supplements, and maybe it dampens it a little bit, but they're like, I'm still having heartburn. And it's a structural thing, and we work on the structural issue, and they can come off of their things, which is great. Yeah. I feel like, again, sometimes we just forget about that, like the actual anatomy.
If your body's not, if an organ is not where it should be, right, you're not going to function right?
Yes, exactly.
Yeah. So what else about postpartum?
Oh man,
I feel like people need to know. I know there's so much. Yeah,
there's so much. I mean, I feel like I can't talk enough about like the support. Support. Like that is the biggest thing. We're here to support you. I see a lot of people in pregnancy, so preparing for postpartum, but also supporting people throughout pregnancy, because lots of things kind of come up. So finding a provider, and then also having those conversations with, like I said before, with your family. So understanding like how things are going to change in your life, because people don't really talk about that much. Like, what is your relationship going to look like? What kind of, whether
with partner and maybe with your mother or your father or your sisters, like things are going to change.
Yeah. So, having those conversations with people before you have the baby, I think is really important, and and also setting boundaries. I think that is something that I really worked on the second time around, because I didn't really think about that the first time, but setting boundaries, like what do I feel comfortable with? When people come over, it's like, okay, when you come over, help us do something. Don't just come over
and watch the baby.
Watch it. Yeah. Like play with the baby, like help us out in some way. Which I wasn't always great about the first time, because again, I didn't know. So especially if this is your first child, I think these are things to just, if you have the brain space, just start thinking about them.
Yeah. And sometimes you might not know what you're going to want, but this is where a really experienced doula can be helpful, because they're going to be like, hey, here are some common boundaries that we see women need to have. Like, you might love your mother-in-law, but you might not want her living with you during it. So let's have a conversation. Hey, we'd love to have you come over every day and make us dinner, but we don't need you staying the night. Or whatever that might be. Or it might be a rule for friends, like, hey, you can come over and you have an hour limit for your visit. Or something, like a simple boundary, and people will understand. Honestly, boundaries usually help others and yourself, right? It's just when you have a clear boundary, like everyone feels more comfortable.
Exactly. And I think if you're a friend of somebody who's about to have a baby, another thing that's helpful is maybe like texting them and being like, hey, here are some things that I can do. Like, can I cook for you? Can I take your trash out? Yeah, exactly. Like what of these things could be helpful, and I'm going to come over and I'm going to do it. Like,
or if
that
you
is
have other
helpful.
kids, can I come over and take your toddler for take him out to the playground, or I'll take him for a play date? Or,
exactly. Yeah, like that. Those things are really, really helpful, because then it doesn't put all of the responsibility on the postpartum person. Yeah. Again, you're tired. You're not thinking clearly. It's just, there's so many, it's a wild time.
I've seen, I think it was a patient of mine that did this, where she created, she had it taped to her front door, and it was like rules when you're coming over to visit. It was like, you can say this amount of time, you might, and it gave everyone options for, here's how you can help us. We'd love to see you, we'd love to meet the baby. And it just was a set of rules. And she was like, everybody loved it. They were like, oh, this is so clear. I know exactly what I can do. I know exactly what I can't do. And it's it makes it easier for everybody.
It's so much easier. And here's the thing, if people are mad about it, then okay, then don't come over. I don't know. It's not about them.
This is your time. You just had a baby.
It's about you and your baby. I have this conversation a lot with women, especially pregnant women, but also just women in general, because I think it's just, we take so much on as, especially as mothers, but also just as people.
Oh, totally. We say yes to too many things.
And so just really setting those boundaries for your own mental health, but your nervous system,
for your hormones,
for your hormones
and your nervous system. The boundaries are a big thing.
I
we do a whole other episode on that.
It's, they're so important.
There's a great book. It's by Melissa Urban, who founded Whole30. It's called The Book of Boundaries. It is fantastic. She gives you great scripts, and so if you're struggling with boundaries in your life, I highly recommend that book. It's a great book.
I'll check that out.
Great book. Yeah. So this has been fantastic. Yeah. Lots of great information. If you guys are curious about learning more about Dr. Anna, you can go on our website, thekinneyclinic.com. There's information about her. You can schedule a free consult. She's great with all kinds of conditions, and we're so happy that she's here. She takes really good care of patients. And if you're looking for doula support, highly recommend looking into that for in your area, and just doing your research, right, on what's going to be, what kind of services, what kind of support, and support. Again, that's the main message. Make sure you're getting support throughout the pregnancy, throughout the postpartum time. And for women, just in life in general. And we talk about that a lot in the show, is getting support, finding a provider that's going to help you walk through this journey.
Get labs run.
Yes, get your labs run. Definitely get your labs run. We're a big fan of that here.
Yes.
So anyways, anything else?
I think that's it. This has been so fun.
Awesome. Well, thank you guys for listening, and we'll see everyone soon.
Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media to find more helpful tips and information. You can find me at Dr. Kinney on all of the platforms. And please be sure to subscribe and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.